The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us of part 3 of our 5-part brick by brick series. Today's presenters are myself, Donna Sarvello. I am the VP for Educational Support with NCV-TMB. I've been a massage professional for over 20 years. I've practiced with physical therapists and chiropractors, and then I began teaching and writing curriculum, and now I'm with NCB for 10 years. Joining me today is Christopher Jones. Hi, Chris. Tell us a little bit about yourself.
Well, hello, Donna. Thank you for having me here. I'm Chris Jones. I've been a massage therapist for over 14 years now. I used to teach entry-level education for massage therapy. I also provide continuing education for National Academy of Sports Medicine, and worked with the NCB many times on item writing and exam committee matters. And yeah, I'm just excited for today.
As am I. And Chris, let me tell you, you are an absolute asset to NCB on item writing. Thank you.
Aw, you're welcome. I'm blushing now.
So, Chris, tell me why you became board certified.
Okay. Well, initially, when I took my licensure exam, at the time, that was the same in my state to sit for what was the national certification at the time, which as a new therapist, I didn't think too much of at the time. And then I kind of delved with it. And when they moved to board certification, I really kind of stepped up my thought process on this. And why I've stuck with it for all these years is because I believe in what the overlying point is here. I am in support of staying educated, staying on top of the profession, for keeping up my skills and abilities to work more professionally, more critically, more in depth with my field, to educate, to communicate. And all these things are embodied in the board certification process. And so I've been a very happy member to stay with this for all this time, and I try to spread that around as I travel and people ask me about it.
Well, thank you. And just to add, becoming board certified just, demonstrates your ability to approach each massage session with a well-rounded, assessment-based approach, and that you have the necessary skills to communicate that approach to clients and, when appropriate, other healthcare providers. So that's in a nutshell.
Mm-hmm.
So, Chris, talk to us a little bit about intake forms and data collection and the importance.
Okay. Well, you remember, all of what we do relies on data. Okay. Now, we usually don't think about it in these terms, but let's take this intake process as an example. Your whole intake, that's just a way to gather information. It's a way to record information, and it's a way to inform what the rest of the clinical session might involve. When you take a client in, you're going to talk with them, and you're going to collect, usually we give them a intake form even to go in as a formal written document or electronic document, as some places have switched to. And you're going to collect different biographical information about them, name, age, things like that. You're going to collect a health history on that person. What's happened in their life? Surgeries, illnesses, major and minor. You never know what could be relevant. My always favorite piece of it, the medication list. Some people have nothing, and it's great. Some people bring me 5-page typed out lists of medications, dosages, and their prescribing physicians. That's also very helpful because I don't like writing down names of medications because I am horrible at spelling them usually. What they're undergoing now. Are they seeing somebody for a condition? And if so, what are they doing for it? And really, the big one that I have the biggest spot for on my data sheet is, why are they here today? All that other stuff is a wonderful look at things that have happened in their life, things that may contribute to what's going on, but why are they here now? Okay, and so I can take all that information, and here's where the process gets more involved and where you really start to have to think through what's going on, is you've collected raw data, and now you need to distill it into something. You take all those history, you take any of that medication, you take the point of why they're here today, you take that data from, oh, they're seeing this other healthcare professional. What are you doing? What are your restrictions, limitations, recommendations? And now we have to think through that and try to come up with what's going to go on. Now, through all this, and I'll probably say this several times during this webinar because I'm big on it, we need to write this down. Memories are not perfect, and we want an accurate list of all these things so that every time we go back to it, we have that written down, and things change over time. And so this way you'll have that written record also of that change, and we have something to move forward with as we continue in the assessment process.
So, what is observational assessment and how does it help us?
Well, there's a lot of different tools under what we would call observational assessment. And this is us, just as it says. We are looking at the client, palpating the client, touching the client, engaging with them, okay? Some of the popular tools, they're listed here, like a postural analysis, for example. That's very familiar. Everybody's seen the plumb line, the weight on the end of the string, or the grid map that's up on the wall, to look for things like asymmetries. There are other ways to do posture, for example. Goniometry is done to physically measure those angles. Physical therapists will use that a lot. Big one nowadays, depending on where you go, they use photography and digital motion capture, so video recordings that can then get analyzed through either by the therapist or through some computer modeling. Really advanced ones, and this is way outside of massage therapy, you can use radiographic analysis. So they'll, they can use imaging technology to take a look at these things. But for our everyday, for something like a postural analysis, you're looking at limb length discrepancies, you're looking at hypo or hyper, lordotic, kyphotic cervical curves for the spine, you're looking at scoliosis, the lateral curvature. You could be looking at different segments of the body being rotated. My favorite is to look from the top down to see some of those. So you actually have to stand above the client. So that's kind of a fun one. And even something as simple as you're standing there talking to them, do they hyperextend their knees while you're just conversing with them? So you can use those tools to kind of get a snapshot of what they're doing. And the important thing to remember with this and the others is that not everything asymmetrical is pathological. So keep that in mind. Remember, we have what's called our average and our normals when they give us all those ranges of this joint moves in this much and this limb does this. Remember, that's an average. Not everybody's there. We have another one here that's very popular, gait analysis. You're looking at motion. Again, low-tech observation. We watch them walk. Do they have a lateral sway? Are their hips even? How do they move in gravity? Things like that. Often, more now, not so much in our office, certainly not in mine, but in the PT clinic next door, they use video capture with a computer analysis to do this. They put them on the treadmill with the cameras, and they can look at it that way. One of the things I get a lot of questions about and a lot of people talk to me about, and I love to use them, is what we call the orthopedic testing, special orthopedic tests. There's a lot of great resources out there from some of the educators in the field. And these are just specific motions and palpations that you're really looking to provoke symptoms that are associated with various musculoskeletal conditions. For those of you who don't feel included in that, neuromyofascial, skeletal, insert your tissue here conditions. I don't want to leave anybody out of the loop. And we use those to confirm what our clients have told us during that intake interview. We can confirm suspicions. They're having some tingling in their hands. Okay, well, there are a series of orthopedic testings that can look for things like we call classic thoracic outlet type problems. So we can use those to help narrow our focus and to design better treatment strategies for it. A lot of people will come in an amount of pain, and we have various scales for that. There are dozens of different tools that are used for that. You have your 1 to 10 scales. You have your smiley faces on the chart. You have a great one that I will mention, the Defense and Veterans Pain rating scale. Please look that one up. That includes both a numerical and a functional component to it. It's quite comprehensive. Again, there are literally dozens of them out there. And we can use those to record the piece of information that we cannot obtain during, by our direct observation. This is something the client can only tell you. This is not something, say, oh, I don't think you're in pain. No, if they say they're in pain, they're in pain. This is not something we can get from observation unless we're looking at different body cues, sweating, favoring different limbs protection, things like that. But that's a different piece of it. But we use those to keep not only a record of what they're feeling, because we can't get that subjectively, but we can now track it. So when we're talking about when do we do all these things, how often do we do these things, we can do them as often as we need to. It's always great to have that base. So that first session, you want to, make sure these things come into play, and you want to record them, and then say, well, do I test this again at the end of the session? Do I test it next session? Do I test it 2 sessions from now? And that's my other favorite answer to things is, it depends. And you'll have to clinically think through what would be the relevant point to measure. Is it, well, how much pain did we relieve this session? And where do we restart the next session? That could be a great piece of information to have. And so by gathering these bits and making sure we record them, we now have something to go to the next time we have a session, the next time we want to look at this problem. Or should somebody get, they get better, they come to this problem 6 months down the road. Well, let's see where you were compared to last time when this happened. See if there's something we can glean from it. So there's all these different tools that we have at our disposal, and there are others, especially if you cross-train in other areas. There's, if you're an exercise person, again, my bias, because I'm kind of half in that realm as well, you've got like functional movement screen is one of the tools, or the selective functional movement assessment, and there are countless others you can use. So there are lots of different courses for all of these things, so I highly recommend taking some of those if you want to get more familiar with them.
Perfect. So treatment planning, why is treatment planning important, and what's involved?
Well, it's important because you want to know what you're doing and why. For every client that comes in, they are telling you a story. And this is something we need to listen to. And listening in our case involves not only the auditory component, but we need to watch them. What are their body cues telling us as well? There's a lot of information coming off the body that's not always conveyed in the voice. And even so much in the voice, it's nuanced. It's the words they're using, but what's the tone as well? There are lots of clues that we can use to really listen to them. And what we need to do is take, again, all that information we gathered during the intake, all that information we took during our assessment procedures. And now we're listening to them to say, okay, what is it their goal is? This is where communication is vital. For me, I don't come out to a client and say, here's our treatment plan, this is what I'm going to do. My delivery of that is, okay, based on what you've come with, here's what I think we'd like to do. What are your thoughts on this? And what I present to them is something that I like to think of it just in this way. They've come with a series of complaints, issues, life story, etc. We've observed all these different things about them. What tools do I have at my disposal to address 1, 2, 3 of those components? There's only so much you can do in a session. So what do I have to address those? Are they okay with those interventions? Maybe, they're having something that's in pain. I think we can do something to get it out, but it will exacerbate it in the, for a few moments, and then should calm down. They don't want to exacerbate the pain. Okay, moving on. We're going to choose something else. I want them on board with the plan, because if they're not, and if they don't say so, it's going to be evident in their body posturing again, and you're going to cause them a lot more stress. So I always like to have this part as a conversation with them. And once we have that conversation and they've had all their questions adequately explained to their level of satisfaction as to what I'm choosing to either prioritize, the interventions I want to take, and how we would reassess them. And once they're on board with that, I'm going to write that all down because, again, my memory is not perfect. I wish I had an eidetic memory, and I do not. And as I get older, I find that it is less and less reliable sometimes, as more and more information tends to want to cram in there. And I write all this down because the next time I come to this person or they come to me, I want to be able to look back and say, here was our conversation. Here's what we planned. And then we'll be able to see where we are. So they, in my office, are kept in the loop on every step of this path. And I want them to have no questions going in so that when we start our treatment, they're on board, they're engaged, they're excited, if possible, and that's what we're going to do. And to follow up with that is really the process of documenting that conversation, the steps you are going to take. And indeed, if that's the case, if they come with 5 things, I can address 2 today, and I'll add in the next session, we'll reevaluate and perhaps add in number 3 so that I know, okay, we have this list. Has that list of priorities changed before their next session? Maybe their symptoms have changed. And we review, adapt, discuss, and continue. And all of that gets written down because if it's not there, it never happened. You'll find that in every clinic in the world, that statement. If it's not recorded, never happened.
Yeah, and if you're working in a multi-therapist office, you want the other therapists to know what you're doing and what works.
Absolutely, because that one day that you're out, that they still want a therapy session, does that other therapist, are they going to be able to go to your notes and say, I know exactly what they were doing. That's wonderful. Or are they going to look at it and go, what does rub the shoulder till it felt better mean? And I've seen that note in a client file. So I only use that example because I've actually seen it, and it was not helpful, I would say. And and if you think you're working not just with other massage therapists, but if you're working in a clinic where that person's going to next see the physical therapist or the exercise specialist or the chiropractor, the naturopath, the DO, the MD, etc., is what you did written out clearly enough to make sense so they will have an idea of what you were working on with that client.
Perfect.
Very important.
Okay, so why is research important in understanding what you're doing and important to the massage therapy profession?
Well, let's see. I'll start simply with this one. Because things change and I don't know everything. That's a personal statement. Research fits into a bigger category of things that I like to call even science literacy in this case, being scientifically literate. We learn science oftentimes as a body of fact in a subject area. We learned anatomy, we learned physiology. Back in high school, maybe you took earth science, geology, biology, all these ologies. The one thing they all have in common is that science is a process. It's a way to verify information, experiment upon it, and come up with conclusions that are verifiably, objectively true. Okay? Now, research is a lot of what we call research, and usually we say, oh, research. That doesn't mean you Googled it. That's just looking something up. Researching it is, they're going through this process of scientifically verifying, coming up with a hypothesis, experimenting, and they distill it into this nice document, which we see as a research paper of some sort. And this is what we pull up when we see an article in one of the journals, or we pop on one of the websites that we'll talk about in a little while, and we look at it, and it breaks down for us all the different things that went into it. What the problem was, clear statement. What the researcher in the field says now. What group did they experiment on? What was the criteria for those people? What were the methods they used to test and the data they gleaned from it? And then the analysis section that tries to explain what that all means. And then a conclusion that comes to either it supported our hypothesis, it did not support our hypothesis, or it had minimal support and needs further study. It's a wonderful thing to see these things in action. And the best part about this is we can use these tools to educate ourselves. And we're taking this information from people who will know more about these subject areas, at least again, personally speaking, than I ever will. And it's a nice place for me to pick it up and say, is this useful to my practice? You know, I can look at something that comes out on a study about a therapeutic technique, and I say, oh, well, technique X showed improvement in Y. Okay, great. That sounds positive. Is this relevant to my client? Well, now I got to look and see, okay, who was selected for this? Who did they experiment on? And if this was a group of 20 to 35-year-olds with no underlying health conditions who XYZ, and my client is a 55-year-old, person with who's had a stroke and has high blood pressure, this is not really going to be relevant to my person necessarily. I don't know that I can extrapolate that. And so having these tools out there gives us more of an idea of things we might be able to try, things we might be able to avoid. Some things might be harmful. Okay. And now any one study that comes out means nothing. You have to look at a collection of fact. You don't get one thing that disproves the world. If somebody comes out with something that says, I have verifiably disproven the theory of gravity. Okay, we have several hundred years of data holding that gravity is a really good thing, and it's all there. One study that says they did something that to counteract that does not disprove gravity. That's the headline sensationalism we get with a lot of these articles that come out, which is a problem in there. It's how to curate that data. But the wonderful thing about the research is there's one, so much of it. Two, it's ever changing. We're always coming out with better and better information. So that's where I stand on that at the moment.
Perfect. So where can we find credible data?
Now, credible data. That's a loaded phrase somewhat in today's environment, but it really shouldn't be. Credible data is just something that can be backtracked, be verified, so you know where information comes from. We start in our field with a lot of things, and we'll call case reports on here. It's you in your massage therapy office and your client. Maybe you have a small series of clients that fits a targeted profile, and you try an intervention. You see what happens. You've just done some research in your own office. You have come up with a hypothesis, a test group. You've tested it. You have your results. Write up a case report. These are wonderful things to submit in our field because it lets people know, one, you're out there. We all work in little bubbles. And sometimes we can forget that there's a very large, vibrant community around us. And this might generate interest, and someone else will pop up. Hey, I had a couple clients who fit this profile, who we did this. And when you get enough interest in things, and this works in a lot of fields, then you start building a data set, and then you start getting people to poke a little more curiosity, and then you end up with a larger, more involved study, and maybe some results that come from that. It's a great way to build that up. And at no point in there do you really hide the data, but at some point, a case report only goes so far. It's really anecdote of N of one, so one subject or 3 subjects, and you're kind of writing that up. That's a good start. You can look at other places. You have different, you fire up the internet, you can find anything. You have all of these different places competing for your attention to say, hey, I have data. Great. Are you willing to back it up? Can you show where you got this data? So if you're coming up with a website and you're looking up a specific thing, do they link references? Are there resources listed there that you can then go look at and verify that, oh yeah, that's where they came from? We have different things like that at our disposal. We just need to know how to be a little savvy about using them and being willing to do that. Because a lot of the times, and I know sometimes I've been a little intellectually lazy and said, I found what I'm looking for, I'm good. And about 10 minutes later, I'm kicking myself going, no, that's not good enough. It's not good enough. And so I need to go verify it a little bit more. And you can always again, let me unqualify that. I don't like always. Usually, when you see something that sounds overstated, it probably is. So when somebody says, oh, this technique fixes, cures, treats, and lists 10, 20 things, a little skeptical. Extraordinary claims require extraordinary, evidence. That adage, and it holds true. But the more pointed you are towards, let's say, expertise, if you're looking at an endocrinology website, you're looking at something a little more credible if you're looking for something in that avenue. If you're pulling up something off of BuzzFeed, hey, this drug cures XYZ, BuzzFeed might not be your best choice.
Right, exactly. And I can't emphasize stating true effects because we have so many people in the world that overstate
Yes,
effects for attention. And it's just not,
absolutely.
yeah.
It's the headline effect.
Yes,
It's overstated and you can't really back it up.
right, exactly. So, where do we find these peer-reviewed resources?
So peer-reviewed resources are, it's pretty much sounds what it looks like. You have a group of people who will decidedly try to poke holes in something to see if it stands firm on what it claims. This is part of the scientific process. Once you get something out there, now it has to be looked at by a group of experts, and by experts that includes both people knowledgeable in the field in which that topic is, and also on people who are just experts at poking holes in research. They're mired in methodology and analysis and all those tools far beyond my capacity to go through, and they will try to shoot down whatever that article was there. And the ones that hold up can be verified, can be shown that the methods were sound, can be backed up by the data sources. These make it through to what these call these peer-reviewed journals. You have them in all the different fields. And I will give one example that ties back to the last slide about credible data and peer-reviewed sources, because I will give this as a caveat because most people have seen this in the news in the last month or two probably. There were articles printed in the New England Journal of Medicine and in the Lancet, two very well-respected medical journals. And it had to do with the topic of the hydroxychloroquine studies. And they were retracted. Now, these got a lot of hype because, well, they put these out, and then to pull an article back is kind of a big deal in these articles. The reason these two journals pulled these articles back and retracted them is because when people went to review the data source that both of the research group used for those articles, they found that they could not verify the integrity of the data. And for that reason, they had to pull those studies and print a full retraction. Now, if you look at them individually, based on the numbers that they used, the analysis was great. There was no real problem with that. The problem was that the numbers they used could not be trusted. So in live real time, in recent memory, we have seen this process of peer review come back and say, you know what, this is not valid. So I just want to make this point to let people know that this process is a living, breathing process, and that as things change, as data changes, as the analysis gets better, we have to reevaluate what we've put out there. So peer review doesn't mean above questioning. It just means that it's going to be critically looked at, and when needed, action will be taken, in this case, retraction in two of the most prestigious medical journals in the world. So I'd just like to throw that out there to let people know that this is an involved process. And if we look at the list of resources we have here, these are wonderful sources. Massage Therapy Foundation is a beautiful cornerstone in our industry who provides us a lot of great information and who will act as, their own little clearinghouse and distilling for a lot of other sources. And I believe all these other sources here are also listed on their website to be able to link to them and and find them, but the International Journal of Therapeutic Massage, I get that monthly inbox reminder, and I love to look through all the studies there. And all of these, there's not one tool on this list that I have not used in one capacity or another. And the wonderful thing about these is that if you just look up something in a regular Google search, Bing search, insert your search bar, your search of choice here, you have a really good way of collecting information that will verify your preconceived notion, bias, whatever, based on how you search it. Those searches are good at finding what you want to find. The next level of search is using things like a Google Scholar, a PubMed. These are a bit more curated. They're a bit more tailored. They're a bit more looked at. And you will find that all of these are perfectly willing to list you their sources, their references, all those things that go for better data integrity, if you will. And so these are wonderful tools to pull in and see how they can help us to educate ourselves, make us better practitioners, and to really, in all of this, just help our clients that much better.
Perfect. And then referring out, when do we know to refer out and why do we do it?
Okay, I said before one of my favorite phrases is "it depends." Well, my favorite phrase links to this one. It says, "I don't know." I don't like to promote myself beyond what I know that I am trained and capable of doing. And when I find I'm in that situation that I say, I don't know what to do for this person, it's time for me to find somebody who can. And so referring out to me is a very, very important step in being a professional. It's knowing where your limits are. And there's nothing wrong with having them. It's good to know you have them. We can get dangerous otherwise. So we have a community. We have other therapists who are trained in other specialties, other methods of treatments, techniques, background information. We have other practitioners around us. We have access to occupational therapists, physical therapists, chiropractors, MDs, DOs, any practitioner of choice. And if it's any doubt as to where you might need to refer this person, referring someone back to their general practitioner, their doctor, with a list of, hey, I'm noticing X, Y, Z, go ahead and write it up for them. Make a nice professional letter that your client can bring to their physician and say, this is what's going on. I'm thinking they need further analysis, and it's not by me. I cannot handle this level of care. And that is something I think is one of the most positive things we could do for our clients, not only because it'll help them hopefully get better, get to their goal, what have you. It makes us that much more trusted a practitioner. And building that trust is really that key point in the client relationship. I don't mind referring somebody out, knowing full well that, I might never see this person again because they came to me for this problem, and now I'm sending them away. I'm not afraid of that because chances are I'm going to see this person again because in their eyes, I was trusted, and they will come to see me again for a next problem to see what they need. Or perhaps they had a friend who had a problem. And this goes back to any business marketing class. You'll find your best referral is a happy client. Well, sometimes doing what's best for them means sending them away from you. And sometimes, that means maybe we're working and things are okay, and they're just not getting better fast enough. Well, guess what? Maybe it's time to try somebody else too. And this, I think, just shows a level of, one, that you value your client. You don't want to waste their time, or in a lot of the cases, their time and their money. And we want the best for them. And again, sometimes the best isn't us. And it's good to know when to know that and how to speak up about that.
Yeah, and one of our favorite statements in massage therapy, when in doubt, refer out.
Refer out. Yes, ma'am. It's in every textbook that we have for a good reason.
Okay. Well, thank you, Chris. To contact NCBTMB for more information, you can check out our website at www.ncbtmb.org or call our 1-800 number. You can email at us at info.ncbtmb.org. And for more information about board certification and resources, go to shop.ncbtmb.org/forms/tools/. Chris, thank you so much for joining us. It's always a pleasure.
Donna, thank you so much. This was so much fun. Let's do it again.
We are, definitely.
Excellent.